Hello everyone, today I'm going to show you some example of infusion injections and hydrogens. So I have some examples that I want to show you that I promise to show you through my next video, right? So these all texts I took from the AHIMA website. So there are various examples, even you also can go through those examples, right? So injections and infusion coding is challenging area. Thanks to vast instructions, notes, hierarchy rules, and pair-specific policies, these are the somewhat you will find there injection and infusions, current process CPT. So injection, what is injection basically? Just to have brief about it. Injection deliver a dosage in one shot. We can also call it shot as well, rather than over a period of time. May be administered by various routes, including subcutaneous, intramuscular, intraarterial, or intravenous. This was all about injection. Now, what is infusion? Administration of intravenous fluid and or drug over a period of time for diagnostic or therapeutic purpose. That is called infusion, right? So medication that is given for an immediate effect, typically within 3 to 5 minutes, is an injection. Medications or solutions that is provided through saline or other solution given over the period of time, usually 30 minutes or more, is an infusion, right? So because while coding, we must know what is the infusion, injections, hydrations. So we must know about this, right? So there are some examples as well. I will walk you through later. So first, see some other things, other important things, which is I just read it. Injection and infusion codes, including hydration and chemotherapy administration, are found in the CPT code book, beginning with 96360 and ending with code 96549. This is the code range. And the section of note include a list of items included in an injection or infusion services, definition of the various types of infusion, proper coding of multiple infusion hierarchy rules, and unit of time infrastructure, right? So use of the list, this section of the service included are, means these all service we don't, one, two, three, four, five. These five we don't code separately because these all are bundled in the infusion, injections, and hydrations, right? So we will not code these things while coding the infusion, injection, and AD facility, right? Use of local anesthesia, we will not code anesthesia separately. Intravenous start, we will not code that. Means start means when this is preparation of starting of intravenous, we will not code that separately. Access to indwelling IV subcutaneous catheter or port will not code separately. Flush or conduction or conclusion of infusion, right? Infusion flush is mentioned there in the report, and will not code that flush separately. And standard tubing, syringe supplies, we don't code these separately because these all are bundled and in the cost of infusion, injection, and hydration. So hope this is clear. Multiple infusion of different substances or drug can be reported separately, right? Multiple infusion of different substances can be coded separately. In situation where a multiple drug are administered on same date of service, the coder should assign only one initial service. So this is very, very important. If we have on a same dose, we have infusion and also IV push, and we have injection, and we have hydration as well. So which CPT you will code initial, right? So first, this is the hierarchy. You will follow the hierarchy, right? For example, you have all the infusion, IV push, injection, and hydration. So first, you have to give priority to the infusion. So if you don't have, your report does not show any infusion, and your report says that ED or RN or in ED facility, one IV push or one injection and one hydration was given, then your initial will be the IV push CPT, right? If you don't have any IV push, then you have, for example, any only hydration, then obviously hydration will be the initial, right? So you have to be very serious during for coding, during coding for this initial, right? You only can code one initial out of these no initial infusion, injection, and hydration. You can only code one initial, right? Next, the another from the initial onwards, you have to code with on add-on code of like IV push and hydrations, right? If the medications are given at the same IV site, when a subsequent or concurrent, this is very important, right? And if the medications are given at the same IV site, if the same IV route, all the hydrations, and infusions and IV push are given through the same route, then you only can have one initial, right? Then for rest you have to put add-on codes. When a subsequent or concurrent injections or infusion is done, a subsequent or concurrent code is reported. For example, if a patient receives an IV push following an initial 1 hour infusion, IV push is reported as a subsequent service, right? So means it's the same thing, means one initial will be there and rest you will put add-on code. Reporting of multiple infusion of same substance drug is slightly different. The initial code reported for the first infusion and any subsequent infusions are reported based on the individual time of the infusion using appropriate add-on codes, right? The note within this subsequent define initial infusions, sequential infusions, and concurrent infusions. So the initial infusion for physician reporting is primary reason for the encounter. For facility reporting, however, the initial infusion is determined by the using the hierarchy, right? So what is sequential infusion? Sequential infusion is defined as an infusion or IV push of new substance. So whenever you see the sequential, so sequential means what? One after other, right? Means one drug is completed, then after finishing the one drug, then another drug is infused through the same IV line. That is sequential, in a sequence, right? At its name itself, uh, clear. So a sequential infusion is defined as an infusion of IV push of new substance drug following a primary one. Means once one finished, then another drug is given. So new drug is given basically in while sequence is done, right? So whether it is a sequential infusion or whether it is sequential IV push, there should be new drug. So one drug is completed, then another drug is given. So now a concurrent infusion is what? A concurrent infusion is one in which a new substance or drug is infused at the same time. So what is difference between sequential and concurrent? Sequential is one after another, but in concurrent it means simultaneously, same time both drugs are running. Two infusions are running together. It means that is a concurrent. So a concurrent infusion is one in which new substance drug is infused at the same time as another substance drug, right? So during the same time or when means one infusion is going and at the same time another infusion through the another bag, but the IV route is same. IV route is same. There is no different IV route, but the route is same, right? But two different bags are connected through the same IV route. So that is called the concurrent infusion, right? So concurrent infusion can, which is the CPT is 96368, that can only be coded once for a dose, right? You cannot code multiple times 96368. An intravenous push is defined by CPT, an injection in which the healthcare professional who administers the substance drug is continuously present and administers the injections and observe the patient. An infusion of 15 minutes or less, right? IV push means an infusion of 15 minutes or less. There are multiple codes for IV push, and the code selection is based on whether the push is initial or not and the time of elapsed between pushes. For multiple pushes of the same non-chemotherapeutical substance or drug. Means what are the IV push basically? 96374, 96375, 96376, right? These are the IV push CPTs. When coding hydration service, there are important factors to consider. A hydration service cannot be reported when fluids are used solely to administer drug or to keep the line open. In addition, do not report hydration if it is performed concurrent to another infusion, right? If infusion and hydration are concurrently going, then we will only code the infusion, not code the hydration. Hydration provided before or after chemotherapy is appropriate to charge, but not hydration running during chemotherapy. Hydration should be reported with other drug administration service, but typically not as initial. Medically necessary hydration is reported with the add-on hydration code when another service is reported as initial. And lastly, hydration service of 30 minutes or less cannot be reported. And one more thing, for infusion, start and stop time must be mentioned. If there is no start and stop time, then we cannot code infusion. We will code that IV push, right? But in case of hydration, if less than 30-minute hydration is given, we cannot code anything to that hydration, right? We cannot. Minimum 31 minutes must be there for to code the hydration, right? Therapeutic infusions have their own set of coding. The initial hour of infusion is 16 to 19 minutes. This is all about the infusion. So 16 to 19 minutes, minimum 16 minutes must be there till 90 minutes. The first initial will be coded. Add-on codes are reported for additional hours of infusion beyond the first hour only after more than 30 minutes having passed from the end of the previous build hour. Means from the 91st minute, 91st minute, we will code additional CPT of infusions. Time documentation is critical since separate codes exist for sequential and concurrent infusions. It is important to note that infusion of 15 minutes or less are reported using IV push codes. Hope this is clear to all of you. Now I'm going to show you some examples. So I will go through first the simple example. I'm just reading out for you. So first example is a 66-year-old patient arrived in the ER and received a 2-hour therapeutic infusion of drug. 1 hour later, he received an IV push of the same drug. How is this reported? So what he received? Received 2-hour therapeutic infusion of drug. So 2-hour infusion. What are the infusion guidelines? Minimum 16 minutes must be there till 1 hour, and next add-on code for each additional hour. So we have 2 hours. It means 96365 for first hour and 96366 for second hour. And 1 hour later, he received an IV push. So he also received the IV push. So for IV push, we will take the initial of, no, we have already coded the one initial here 96365 and 96366 add-on code of infusion. Then if we here we also have to code the IV push, right? The CPT start 96374, but this is the initial, so two initial cannot go together. So to code the IV push in this scenario, we have to code 96375. So what will be the final CPT? 96365, 96366 and 96375, right? Rather than coding the another initial from the push, we will code the add-on. Another example is a 62-year-old patient come to the ER complaining of pain in his leg and back, saying he feels nauseous and lightheaded. The hospital starts an IV and gives a bolus of normal saline to hydrate the patient from 7 to 7:20 a.m. At 7:15 a.m., an IV push of morphine is given. How is the reported? How is this reported, right? So here, the main thing that we need to note that what are the infusion, whether infusion is given, hydration is given, or IV push is given. So what we have to first identify from the report, the hospital start an IV, right? Gives a bolus of normal saline. Normal saline means what? Hydration. To hydrate the patient for 7 to 7:20. So 7 to 7:20, what is the difference? 20-minute difference. So can we code 20 minutes of hydration, right? At least 31 minutes must be there. So here it is 20 minutes, so we cannot code any hydration, so no CPT for that. At 7:15 a.m. an IV push of morphine is given. So 7:15 a.m. an IV push is given. For that IV push, we have to code 96375, sorry, 96374. So this is the only CPT we have to code in this scenario, which is 96374. I hope this is very clear to all of you. Now I am going to show you the another example of that can be little longer video that can, but I still want to show you. So here, this is my second screen, and I just want to show you. I think this is very good example, so that's why I want to show you. So here, ED physician gave Jofran 4 mg, right? So this is the day one. Another Jofran 4 mg IV push. Another Jofran 4 mg IV push. Morphine 4 mg IV push over 2 minutes. Deloaded IM 1 mg IV push. Once and NS. This is hydration, right? So hope you are you are able to see my screen very well. So even you can zoom it out, and you can, if you are not able to view it with clearly. So Jofran. So here the things that need to note that here, see the site, right antecubital, then left antecubital, then left antecubital, left antecubital. Here it is right antecubital. Delodil 1 mg ibipus once given on the right antecubital, and NS was given on the left antecubital. So first you have to check you have to divide your work between the site, right? Code separate CPT for left in once, and then again code for the right. Then you have to code in order to avoid the bundling. You have to add some modifiers, right? So Zofran started at 1745 4 mg at right anticubital. So first I would like to code the left side CPT. So I'm just taking this color, right? So left side CPT. So I'm only coding the CPT left side. This is IB push, this is IB push, this is IB push, and this is IB push, right? These. So first yellow, all yellow you are showing are of then left side. So first we are coding the yellow one, right? So IB push start. We have IB push and we have hydration, right? So IB push we will start with 96374, 96374, right? And there is a Zofran at the left side, the same drug, Jofran and Jofran again. So another Jofran, there must be, if there are two IV push of same drug, so there must be the difference of 30 minutes at least. So one was given at 30:29 and another was given as 14:31. So at obviously there is even more than 30 minutes difference. So we can code it. So we will code it 963376 for same drug IV push, right? 96376. And another one is morphine, which is different drug. So we will code it with 96375, 96375, right? And we also have NS, right? 1329 to 1530. We have to code this. But before coding this, we have to, minus some subtracts of, the IB push time. For example, here, I think, is there anything that we need to subtract? Okay, 1329 to 1530. We have more than, even more than 2 hours, or at least 2 hours. So we will code it 96361 for 2 hour hydration, 96361 add-on code, because here we have take the initial of IV push, right? So okay, so it's good to go. So and normal saline, right? 1329 to 1530, at least 2 hours are there. So we coded 96361, 96361 twice. And now we are, so left side is all CPT we have all coded. Now I'm coding from the right side CPT with the different color, just to make clear. Right side CPT, right? So right side CPT, here Jofran ran for over 2 minutes, right? So Jofran CPT, this is IV push, so 96374, because this is again 96374 we are coding, because this is the different, this is the right side, right? Different structure. And another CPT, this is the right side, another blue one, deloaded. So this is again the IV push, right? Of different drug. This is Jofran, that was Jofran, and now this is deloaded. So we will code it 96375, right? So now, in order to avoid the bundling, because on the same DOS there are two, two more than one same type of CPT, like 96374, 96374. So in order to avoid this bundling, we need to add modifier with that. So any of the CPT you can code access modifier, different structure, right? Because this is the left and this is right. So we will add access modifier here with this access modifier, right? So this is the, these are the final CPT you have to code in that case, right? So hope this was very good example, and hope you all have understood the what was all about this, and hope you got the point what I wanted to explain you. So this way you have to code all the CPTs of infusion and injections. So if you have any other confusion, if you have any other example, you can mark me through under the comment section, and you can, I will definitely solve that question for you, right? So I would like to say you just thanks for watching this video, and don't forget to subscribe, like, and share this channel. So have a great day and keep watching, keep coding.